All right, Dr. Umer Khan here again. A tricky question and a very important question. How do you handle conflict in the medical workplace with your colleagues? Now, this could be a difficult question to answer. However, we're going to talk about, give you sample answers so you can answer this question with confidence. The bad, unprepared answer is going to be first. I haven't really had any major conflicts with my colleagues, so I'm not exactly sure. I usually just avoid arguments and I try to stay focused on my work. If someone's upset, I just let them be, and I think that the situation usually resolves itself. I think that I just keep my head down and I can avoid most of these conflicts. All right, so why is this not a good answer? Well, one, you are doing an avoidance type behavior. The candidate is suggesting that avoiding a problem instead of addressing it is the way to go, but that is not a constructive way to deal with workplace conflicts. Then there is lack of specificity. The answer does not provide any specific example or understanding of how they will actually handle a certain example, right? And there is no real insight. You're not talking about how you see, how you interpret a conflict. So this is a red flag for any team-based environment. Now let's move on to the good answer. Well, that is a very important question. So in a high-pressure environment like medicine, conflict is inevitable. But I do believe that how we handle it is what makes the difference. I approach conflict by focusing on open communication, active listening, and trying to understand the other person's perspective. One example that comes to mind is that during my clinical rotations, when I was working with another resident on actually a very busy day, we were under real pressure with a high patient load, and there was a misunderstanding about the division of tasks, and the other resident became frustrated, and the tension started to affect how we worked together. Sort of this was all happening passive. Instead of letting the situation escalate, I took a step back and I asked if we could quickly regroup and clarify our roles and expectations and actually look at each other's tasks and patients lists so that we are all on the same page. I expressed that I understood the frustration, but it was important for both of us to be clear on how we could best work together to manage our workload. By just calmly addressing the issue and discussing how we could better communicate throughout the day, we were able to realign our thought process and distribute the tasks more effectively. We had to change more. I ended up getting another patient, and ultimately we ended up delivering better patient care. I found that when conflicts arise, it is of course very crucial to acknowledge the emotions that are happening and address the problem directly and collaborate to find a solution. I also try to involve a supervisor or another team member if the issue needs further resolution or if one party is not being reasonable. But I always aim to solve conflicts constructively and quickly to keep patient care to be the top priority in any clinical situation. So to me, I think that is a much better answer. Why? A proactive approach. The candidate shows that their willingness to address the conflict head on in a respectful and a constructive manner. And it is also giving a specific example, a real life example that actually happens all the time. And it's relatable. The example is realistic and shows self-awareness in a high stress environment, like any medical setting, especially the inpatient setting. Then collaboration focused. The candidate emphasizes working together to find solutions because the candidate may not be always right. And as I mentioned in the response, that I actually ended up gaining a patient, adding to my workload, and I was willing to accept that. I was willing to take that. I was not just saying, okay, hey, that's how the cards are dealt and it's your problem, not my problem. That's not a team player. I'm going to be having 3 different versions of this answer, because there are many different situations that happen in the workplace, and most of the answers in my program that you will find is that I have at least 3 different scenarios of answering these questions, and I'm providing templates for this. So make sure you look at these templates and how they can be suitable for your particular environment, and you can have different options on how you will be answering these type of questions that are very, very important. One of the template answers I'm going to give you is about conflict over treatment approach. Then we're going to talk about an answer, a templated answer, where you can plug in about conflict over miscommunication. And then the answer will be regarding conflict over feedback given in front of the whole team. Now that could create a scary situation, right? If some other resident is providing negative feedback about your admission, about your presentation in front of the attending and other possible residents or interns or medical students perhaps. So check that out, and that's a major part of my program, to have different versions of the same question, different answers to suit your personal needs. I'm Dr. Umer Khan. Thank you. You need some more help looking to connect, then I will have links in the description, and you can probably find my 25 questions and answers, a PDF. Gives you the questions and the answers, and you can practice on your own. You need further help, you can check the link in the description as well. Possible sessions with small groups as well as possibly one-to-one. And if you want to become a member of my channel on YouTube, and we will be having live interview preparation sessions as well, consider becoming a member there as well. And of course, we'll chat over on Facebook as well. I will have all the links for all of my social handles in the description. Hopefully it helps. Thank you.